is Gina. I'm one of our physical therapists and clinical specialists working at Aspen Aftercare. And I'm here with one of our patients who just completed her 30-day follow-up after doing 10 treatment sessions of the Aspen treatment for capsular contracture. So if you could tell any viewers watching just a little of your history, your surgical history for your breast, and the first symptoms that you had.
Sure. So I had my surgery, it was February 6th. I had my implants changed out. The first time I had no issues with them. Then when I just changed the implant sizes, and I was doing some movements because I have 4 kids, and I must have torn one of the stitches. So I started to get a hematoma and some bleeding in my left breast, and from there I developed a contracture. And so when I went to the follow-up with my plastic surgeon, she recommended going up to Aspen.
Okay, and what were some of your symptoms? How did you know you had a capsular contracture? Did you have pain, firmness?
Yeah, so there was a little bit of pain, definitely firmness. It was not as mobile as the other side. It hardly moved. It was definitely harder.
So Rebecca came to us. She did 10 treatment sessions, which consists of ultrasound, some manual therapy. We give you a home program to also do at home. And so at this point, we're following up with Rebecca at her 30-day follow-up. So she went home after treatment and for 30 days did a home program that we had. And at the end, Rebecca, why don't you tell them what your improvement overall in softness, 0 to 100% is at this point?
Yeah, I'd say 100%.
Okay, and then positioning when she came in, her breast, let me just take a quick peek. It was just a little higher at the bottom and at the top of the breast. And so now she is level, both at the top and the bottom. And so she rated like the symmetry, again, at probably like 95 to 100% symmetry between the two breasts.
Yes.
So any recommendations for anyone watching this that may be considering going in for treatment, that may be experiencing symptoms that you had?
Yeah, so I think since I started so quickly, I think my doctor had diagnosed the contracture, I want to say 3 weeks post-op. And then that day she recommended that I go up to Aspen. And then I got an appointment. I started the treatment up there, I think right at 4 weeks post-op. So I think since I did it so quickly, I think that helped a lot with the results as well.
Right.
Yeah, I would definitely recommend it.
Okay, perfect. So over the course of treatment, Rebecca was able to treat it conservatively, meaning she came for treatments, but she didn't have to have any downtime, any recovery time. She's able to do her normal daily activities. She's able to work, take care of her kids. She's a very active individual, so she was able to continue going on her daily runs, all while treating this, and getting like near perfect results now with softness and positioning.
Hey everybody, thanks for watching. Again, Tim Wine, clinical specialist here with the Aspen After Surgery Center. So special thanks again to Rebecca and all of our patients who shoot these videos. We like to bring real patient results to you without any sort of bias. Rebecca is a real human being. She is not a social media influencer paid to come in and tell us. She's a real patient. Our results are real. Our testimonials are real, hence the reason why we put so much energy and attention into this. If any of you watching this have any comments, if you have contracture, if you have friends with contracture, if you have any questions, please comment down below in that section. Super important. We answer our comments and follow up with you. If you have any sort of clinical issue, don't forget we offer virtual evaluations from anywhere in the world, where if you have a question, concern, you meet with a real clinical specialist like Gina, who can take a look at you, evaluate you, examine you, tell you what you know, we may be as a solution, or even worst case scenario, if we're not the solution, what is a plan B to, you know, find another solution? And don't forget to hit that click, like, and share button. Tim Wyatt signing off. We'll catch you in the next video.